Okay. My name is Amelia Lyons, and I'm looking today at comparing Proctor's task-focused supervision model with Bernard and Goodyear's discrimination model. Okay, so I'm going to start with Proctor. I think there are some likenesses and similarities, but I think overall the Bernard and Goodyear model adds a certain amount of depth to the Proctor model, where otherwise there needed to be. And likewise, the way Proctor's philosophy works, I think also adds something to the Bernard and Goodyear model. So let's get into it. So Proctor sees supervision very much as a cooperative facilitating process with a twofold aim: for the worker being supervised as an effective working person, and also to offer a forum in which the worker renders an account of himself in order to assure herself and anyone requiring her to be accountable that she is practicing responsibly. Now, what I like about this is that Proctor's view of supervision is very wide-ranging. I mean, in this case, the model came from something that she did in the youth work area. She'd see clinical supervision as being applicable to youth work, social work, counselling, and health services, and right across the board. Whereas that Bernard and Goodyear model tends to be focused just on counselling and psychotherapy. So she sees it as a much wider ranging event. And she's also very collaborative and cooperative in the way that she sees the responsibilities of both supervisor and supervisee. We'll look at that a bit further shortly. Now, she sees that this is a task-focused model, and she sees three major tasks in supervision. So the first task is about restorative and supporting the individual about the welfare of the supervisee, about them enabling them to debrief, really listening and exploring some of the issues and allowing them to talk about their experience. And within that, then looking at their own personal boundaries and their well-being and how they're kind of feeling about their experience of work. Developmental or the formative area, that's the development of skills. So, for example, a supervisee might be in counselling and looking at developing their skills in CBT or another form of counselling, and it's essential that their supervisor is more skilled than they are in that particular area. So the development of skills, so that could be in that area, but it could be in other areas too, of course. And then the normative area or the managerial, what I think of as the professional and ethical. So that's when you're working with someone and you're looking at how you're managing yourself appropriately at work, your professional and ethical boundaries. And that's where it can be quite useful to have a supervisor, especially when you're starting out in your career, as somebody who's more practiced in that particular profession than you, and they can help you along the way in terms of looking at really how those professional codes of ethics are applied in practice. And then as we go on in life, the nature of and the balance of each of these tasks may vary. So as we become maturer in our work, we may look less for the restorative elements and more for other elements, although my experience actually isn't that. It's always supervisors need that restorative element more than anything. But the other ones, skills development mid-career is very important. People are sort of defining their own niches and becoming more expert in their work. And the managerial, the normative, that can vary. For example, if you are a manager and ethics and professional issues become super important, and that can be a real specialism there. So 3 joint tasks in supervision, the balance of which varies over the course of one's career and can sometimes, of course, vary week to week. Proctor emphasises that the working agreement should be spelt out. All right, so the central focus, as she sees it, is the effectiveness of the supervisee. That the supervisee accepts responsibility for their continuing professional development. The supervisor needs to make really clear and transparent if they are in any kind of assessment role, which often in supervision groups, for example, when you're on a course, the supervisor might be in an assessment role, so that needs to be clear. And that they are both clearly contract to develop the skills appropriate to their respective roles. And she goes on to further, examine the responsibilities with the focus on the supervisor making a safe enough space to enable trainees to explore and clarify their own thinking, to enable them to share openly, to challenge personal professional blind spots, and to be aware of the organisational professional context. The trainee supervisee needs to identify the areas that they need help. They need to be able to increasingly discuss the issues freely, be able to identify what they want from supervision, to become more and more aware of their organizational professional context, to be open to others' feedbacks, to monitor tendencies to justify, explain, or defend their practice when they're perhaps in a supervision group and receiving some feedback. So she emphasizes that, monitor your tendency there to just kind of defend and explain yourself, as opposed to just receiving the feedback and giving it some thought. Develop the ability to discriminate between what feedback is useful. To share with members the responsibilities of the supervisor so that the safety and challenge can be possible in the group. Okay, so that within the group that everybody can hold some level of safety and challenge. And to monitor tendencies to advise or compete. Of course, in supervision groups, there's inevitably an element of rivalry, and I think that's what Proctor is referring to there. But she definitely places that there is a responsibility on the supervisee to disclose as appropriate. So when she talks about supervisor skills, she talks about the ability to listen, create rapport, validate, respect, understanding, genuineness. All of these things are really important. Also some challenging and assertiveness skills and some teaching ability. Supervisee skills, ability to recognize what is problematic in their work, to share it appropriately, to be open and discriminating in the face of feedback, and to be self-disclosing. She recognizes that this assumes a high degree of awareness into personal sensitivity and political nous, plus the ability to communicate openly and clearly. So it's helpful if we can recognize more often when we're not communicating honestly. This is a direct quote from Proctor. When we're not communicating honestly and make conscious choices about how openly we speak about what lies between us. Okay, conscious choices about how openly we speak about what lies between us. Well, that, of course, is all about the relationship, isn't it, between the supervisor, supervisee, maybe the supervision group, the level of trust there, and to what degree can I trust this group to sort of really lay myself out, and what I'm really questioning about my practice here. To what degree am I going to be prepared to disclose from the supervision's group point of view and the supervisor's point of view? To what degree am I going to be prepared to really listen to this supervisee, to maybe challenge and be assertive enough to kind of stay with the difficult bits sometimes, which it's kind of easy to say that was all great, isn't it? And it's a bit harder to pick out the bits that might need a bit of work. And teaching ability as well. So that's something that's recognized as a generic supervisor skill. Proctor then goes on to give some examples of formative, normative, and restorative tasks in supervision. So she gives an example of a professional who's leaving the organisation, asking for time to review their work before leaving. It soon becomes clear that she needs to talk about her feelings of loss and disorientation. Okay, I'm assuming that's taking place perhaps with a manager or an exit interview or something. So the formative task becomes restorative. Okay, so that kind of managerial task suddenly becomes more about that sort of supporting well-being issue that we talked about. The second example, a health professional talks about the ethical and legal dilemmas in their role with a patient and their family. The group talk in depth about issues of confidentiality related to the case. So that would be a normative task, all about boundaries there. And that's kind of clear. And then this one, I think we drew from actually an experience that I've worked with in a supervision group. So a nurse in a CAMS talks about a young boy they are working with, having some confusion about roles and responsibilities. The group undertake an organizational sculpt to indicate the complexities of the system and the different expectations placed on them, both by other stakeholders and them themselves. At the end, the nurse is much clearer about the limits and boundaries of their role and feels relieved. So that would be quite a detailed sculpt, looking at a lot of the issues there and having a whole group involvement. So that would be quite a skilled piece of supervision work there. But you can see there how each of those tasks may fall into may evolve from one to another, or may, in the latter case, contain all three tasks, right? Normative, formative, and restorative elements. So you can practice that by, first of all, just talking about stuff in supervision and inviting the group to discuss, well, how would we classify that as a task? Which title does it fall under? And then Proctor adapts Roger's propositions for the supervision that she promotes. So this is quite subtle, but I think quite important. So Proctor says that to the extent that the supervisor can be transparently respectful, the supervisee can be self-managing. To the extent the supervisor can be empathic, the supervisee can be honest. So, for example, there's an assumption there that the supervisee might not be so honest if the supervisor wasn't very empathic. To the extent that the supervisor can be trustworthy, the supervisee can be confiding. Okay, which that's a fairly obvious connection there. To the extent the supervisor can be open, the supervisee can be respectful. To the extent that the supervisor can be straightforward, the supervisee can be self-appraising. So I'm assuming there that Proctor is referring to the feedback that the supervisor is prepared to offer, and that if they can be pretty straightforward in their feedback, then the supervisee can face their kind of self-appraisal quite squarely and look at themselves and their feedback in a clear way, as opposed to sort of rose-tinted glasses or some slightly distorted sort of manner, because it's a learning situation, so nobody's going to get everything right. So that concludes Proctor. And if you like thinking about the person-centered approaches to supervision as a whole, let's just revisit Uncle Carl Rogers. So in his programs for supervision in client-centered therapy, group therapy and supervision practicals were at the core of their experiences. So on our supervision course, we have an experiential group. We don't have group therapy. Primary focus of the experiential group is to learn, not to have therapy. But nevertheless, you can begin to sort of recognize the attitudes in action. And what Ledick talks about there is the foremost aspect of person-centered supervision was the modeling of the necessary and sufficient conditions of empathy, genuineness, and unconditional positive regard, all of which I think when we go back to Proctor's propositions there, you can see the empathy, the trustworthiness, the positive regard in terms of the use of the word respect that she talks about there. So that thereby endeth, if you like, the sort of person-centered series of supervision models, and Proctor being one of those. Now let's go to the comparison between Bernard and Goodyear and Proctor. So with Bernard and Goodyear, they talked about there being kind of three roles that the supervisor has in the supervision program. Now, bear in mind, this is relating to counselling, but I think we can see it across the board anyway. There's no reason that this needs to be limited just to counselling. But they saw the supervisor as holding these three roles. So as counsellor, as teacher, and as consultant. So as counsellor, they didn't actually see that the supervisor would be counselling the supervisee, but that there would be emotional information that would surface in the sessions that would be discussed and identified. That may be enough. Sometimes it's enough to recognise what you're feeling emotionally, and you can kind of let it go. But sometimes what happens is that it may distort in some way the supervision or limit the supervision. You might identify together with your supervisor in that counselling role that you might need to take it and do some further personal work in that area in order to enable the supervision further, but also you've hit on something that you realise is limiting you in your professional practice. So the role of counsellor, the role of teacher. So that's, as we've talked about, in terms of the instruction of skills and the development of skills. I mean, I might sort of see that as more facilitator than teacher role myself. That's a word I might prefer. But the word that Goodyear used was teacher. And then the role also development of skills. So then the role of consultant. And Goodyear and Bernard noticed that the consultant was more of a sort of adult to adult kind of role, whereas a teacher might be a bit one up, one down kind of thing. And the sort of counsellor, supervisee, perhaps something else. But the consultant role would be a sort of professional to professional role and would be quite peer in nature. And if we compare that to Proctor's kind of three tasks, where we saw restorative, formative, which is educative, and normative, the boundary and ethical manager, and I can imagine that professional to professional, I might talk with other professionals about where my boundaries are and what challenges I've had in those areas on a very much a peer-to-peer basis. So I think those two are very similar in their approaches and in their tasks. So that's a kind of similarity. Now, what Bernard and Goodyear go on to develop, though, which I think further enriches this model, is that they say then that there are three elements of the model that then need to be unpacked, via those roles. So the case conceptualization. So that's when we're talking about clients, how do we conceptualize the case? How are we seeing? What's our understanding of the whole person that the supervisee is dealing with? How do we conceptualize that? How are we seeing it? Are we all seeing it in the same way? Often these things are not discussed or not discussed fully. And need to be, because people might be seeing these things in quite different ways. The treatment or intervention. So looking at those issues, what do we see as being an appropriate or helpful intervention to make? What's on the table? How will we address this in our professional practice? What's the plan? So checking this out in supervision, exploring the options. And then the personalization, which is around what's happening between myself and the patient as in the supervisory role, what's happening here. Am I over-identifying? Am I getting caught in transference, counter-transferential issues? What are my blind spots? What's going on between us? And again, as we discussed earlier, that kind of supervisor in the counsellor type role we might then unpack that. So you can see then that the discrimination model goes on to, you can see going across the top there, the supervisor, teacher, counsellor, consultant, and then going down the side, how in each of those roles the case may be conceived, the treatments and interventions are thought about, and the personalisation, blind spots, and so on are explored. So that's what I think is beautifully rich there about the discrimination model, and it really adds depth to the idea of the Proctor model. Yes, it's kind of focused, though, you might say, on the supervisees, clients or patients. What if in the supervision group that the person is actually talking about themselves and their own struggles with work? Would you then have a case conceptualization? And if so, how might the person see that in the supervision group? So that could be interesting to think about in that way. But so there may be areas where the model may be very helpful and other areas where we might want to more carefully think about that. And then finally, in terms of the discussion and critique of Bernard and Goodyear, and I think some of these same critiques can also be levelled at the Proctor model. So in both the individual and group models, this is true of Bernard and Goodyear. Interestingly, Proctor also did individual and group models, but we're only looking at her individual one at the moment. It is suggested that the supervisor be watchful of falling into certain habitual roles and needing to flex to the needs of the supervisee. So if I just whip back there to, you might find yourself in one of these roles a bit stuck. You might always be in teacher role. You might be in sort of overdoing the counselling role. You might be more consultative. So the idea there is to flex between the roles according to the needs of the supervisee. So that's why the discrimination, we need to distinguish and discern the needs of the supervisees and then try and meet them as best we can. So it has been the Bernard and Goodyear model in America, widely used, accessible, and very empirically validated by research. The only thing that wasn't was the role of the consultant in that, but the other two roles were apparently empirically validated by research. But it was critiqued for not paying enough overt attention to the supervisor-supervisee relationship. And that's where I think Proctor is stronger, is that she really takes on the responsibilities of the supervisor or supervisee roles and sees that as very much about an effective working alliance. So she's very strong on that. And perhaps that's not featured quite so much in the Bernard and Goodyear model. At least that's a critique anyway. They'd probably defend that, but it's a critique. The model's atheoretical, which means it can be used flexibly, and I think that's in a sense true of Proctor, although it's imbued by a sort of person-centered, cooperative and collaborative approach, that actually you could adapt that model and use it to understand a number of frameworks, supervisory frameworks there. Bernard and Goodyear also criticised lack of serious attention to multicultural supervision. Bernard responded back to that, arguing that cultural awareness needs to be infused throughout the model. And I think that is a fairly good defence because it does need to be throughout the model. So I tended to sort of, and I think the same critique could be levelled at the Proctor model as well. So that's it. I hope you found that useful. Thank you.